One has to defecate after eating. This is a known fact to all. But where to defecate? This is known to very few. Perhaps that's why 14 million Nepali people defecated in the open just this morning. He is Dhana Bahadur Pariyar from Dharmapur, Chitwan. For 33 years, he had defecated in others' field. But now, it has been 2 years, he has built a toilet in his own yard.
They scolded me, "Why did you defecate in others' plot? Hence, now I have built a toilet in my own house."
Dhan Bahadur faced many problems while defecating in others' field. Their regular scolding and ailing badly hurt his self-esteem. One day, while defecating in the open field, a crowd of children chased him. His sister-in-law, Savina, also encountered the same situation. Such humiliation and suffering made Dhan Bahadur to construct a toilet at home. This man, who barely makes his living out of sewing clothes, worked very hard to build a toilet. Now, he is totally relieved. Presently, all his family members are using their own toilet.
Without a toilet in the house while going to others' field, the children chased me. So, now I have constructed my own toilet. All my family members defecate in the toilet at home.
Still, many Nepalese are following Dhana Bahadur's past habit. Simply stated, thousands of Nepalese still continue to defecate in the open as more than half of the country's population don't have access to toilet facilities. According to the government of Nepal, only 46% of the people in Nepal use toilets. Not just a person at an individual level, but the whole family, society, nation, and the entire human race is facing the adverse effect of open defecation. According to the experts, in developing nations like ours, more than 80% of diseases are waterborne and are caused due to poor sanitation. As per the Ministry of Health, every year, 10,500 Nepali children below 5 die from water and sanitation-related diseases. This is more dreadful than the loss caused by any natural calamity or disaster. Not only the sick people, but also their family members lose their valuable time as a result of illness caused by poor sanitation. The loss incurred by the nation in terms of the total productive days lost due to such illness and its treatment has been accounted to around 10 billion rupees per year, according to government estimates. Efforts are being made to minimize this critical situation created by the lack of improved sanitation. Since 2003, the Community-Led Total Sanitation (CLTS) approach was adopted in Nepal by various organizations active in water and sanitation promotion, including Nepal Water for Health (NEWAH), to facilitate communities to be free from the habit of open defecation. The impact of this program, led by communities themselves, has resulted in various communities being open defecation free and moving towards total sanitation in Nepal.
Before, with outsiders and the facilitators, your community members went flagging the open defecation site. Now, if we go around the community like before, will we find any feces lying around?
No, you will not spot it anywhere.
Now, if we stroll around the community, will we need to flag open feces as before?
No, sir.
Really?
Absolutely not.
This is Dumre Ekata Chowk, located in Urlavari VDC of Morang district. People might know this community for various specialities, but many recognize it as the first open defecation-free community of Nepal. 6 years back, there wasn't a single toilet in the community. Feces could be spotted all around. There used to be piles of feces along the beds of the river flowing through the community. Children's playground and river gullies served as toilet for its people. In 2004, after the implementation of CLTS program in facilitation of NEWAH, it gave the community totally a new look. Toilets came up swiftly in all 70 households. No feces could be spotted along the riverbeds, fields, household surroundings and yards anymore. After all, within 4 months, this community was declared as an open defecation-free area. Now, there is a toilet in everyone's house. The houses and yards look neat and clean. From children to the old, now all are habituated to use a toilet. Each and every community member have started washing their hands with soap and water at critical times before preparing, eating or feeding a meal, touching dirt. The practice of keeping food and drinking water covered has been sustained. Initially, even the residents had never imagined that their community would go through such transformation. That's why the Child Club had to put in immense effort to bring changes in people's behavior and perception.
The practice of building toilets did not exist then. Everyone defecated around the house at the time. We would get up at 4 before dawn and blow our whistles to prevent people from defecating in the open. Initially, nothing worked. After much of our telling, they slowly started constructing toilets.
Efforts to promote sanitation in Nepal are not new, but the policy of providing subsidy for toilet construction has remained much in practice. The subsidy-based sanitation program raised hope in people's mind, but failed to bring sustainable behavior changes and the desire to change internally.
The subsidy-based programs develop only a give and take tendency, therefore failing to raise a feeling that sanitation is necessary for me in individuals. So neither could toilets be used appropriately nor sanitation gain totality. We have even found misuse of subsidies in some places. Therefore, we have adopted the CLTS approach. Many types of triggering tools are used in it. It makes people more aware about their sanitation. Individuals construct a toilet through their hard work and labor, realizing that they have to build toilets on their own and thereafter take the sanitation campaign forward in a sustainable and effective manner. That is why the CLTS approach has found success.
The CLTS approach has been developed taking into consideration the past experiences. Community themselves need to lead the process for sustainable sanitation. Being the main essence of this approach, at first, awareness is ignited among the people. For this, various triggering tools such as shameful walk, feces mapping, feces calculation, developing an action plan, follow-up and monitoring are facilitated in the community to bring changes in their awareness level. As part of this process, initially a shameful walk is taken along with the members of the community to identify areas of open defecation. Observing feces lying around haphazardly in the presence of an outsider makes them feel ashamed and disgusted. Since this happens to be a walk of shame for the local residents, the feeling of shame that is developed motivates them to stop open defecation from within.
What is this?
It's fishes.
Are you sure?
Yes.
Why are you covering your nose? Smelling bad?
Yes.
But you find ample amount of these in your pathways, don't you?
It's palm.
While going to your mustard field, it's the same, and also by the stream. What did you say this river is? You called it Betari, didn't you? Along the riverbeds of Betari, in fact, there is so much of it.
To locate the areas of open defecation in the community, a community social map is drawn through the initiation of community members. Community members are requested to indicate toilet sites, water sources, and places of open defecation in this map. To identify feces in the areas of open defecation, locally available yellow powder or material is used. When people observe that a large part of the community is occupied by open feces, it gives them a negative feeling towards open defecation. Asking them to sit on the open defecation spot as identified in the map, they feel ashamed. As a result, people realize from within that they should not defecate in the open areas.
Okay, Mr. Bose Prasad.
That's me.
Find a name to locate your house and sit on that spot.
Next to my daughter-in-law.
Right next to your daughter-in-law, yes? Where did you go? Did you go behind your house or along the pathways? Please point to us that place. You have all squatted in a row to defecate. All these faces seems like mustard flowers growing all over the community, isn't it?
Yes.
All the villagers are looking at you. How do you feel defecating next to each other?
No, I didn't feel good.
Uncle, what happens when you sit like this?
It is better if you have a toilet than to squat like this. It is not nice at all to defecate like this while others are watching you. It's not good. It is shameful, disgraceful.
To further reinforce the feeling of disgust towards open defecation, feces calculation exercise is done to find out the amount of open feces produced by community members and collected in a day, a week, a month, and a year.
If you collect the feces defecated in open areas by 633 people of the Tilkanipur, your community, it comes out to be 68,400 kilos of feces collected on yearly basis. Where does all these feces go?
The sun dries it up, is washed away by water, eaten by pigs.
If you all go for open defecation in the community, where is it that you go?
Here in the jungle, along the river beds and streams, children defecate in the pathways and also near the household surroundings.
When we work out the amount of open feces collected in Tilkanipur, it calculated to 68,400 kilos of feces lying in the open areas. You have already stated that you ingest it through various means. Among these, you pointed that feces is ingested through flies carrying it to your food. Sometimes through the drinking water, maybe through the vegetable ground in your field where you defecate. Now you tell me, will you continue ingesting feces like this, or indeed immediately? It is up to you to decide. I have only portrayed the situation of your community. If you still want to live like this, want your children to keep ingesting and be covered in feces, then I have got nothing to say. Okay.
You have already told us that we do not ingest it directly, but indirectly somehow. Now, since we know, we will build and develop the habit of defecating in a toilet only.
Okay, now you will all wheel it off?
Yes.
This tool is adopted to make people realize that a lot of feces accumulates in the open areas of the community. Efforts are made to demonstrate that some portion of the feces collected in the open is ingested indirectly by the community members through various means. To bring realization among people on how open feces finds way into our mouth, the feces transmission routes are discussed. This tool helps identify the different mediums through which feces is ingested by the people, such as dirty hands, flies, domestic animals, contaminated water. Once the community members commit not to defecate openly, monitoring takes place, taking into account these changes in the community.
The people from these houses with yellow tika are using a temporary toilet.
With the initiation of the monitoring phase, a mapping exercise is done to find out how many people in the community have stopped open defecation. Observing the transformation in the community by means of this map makes everyone feel happy. At the same time, supports people to internalize the importance of good hygiene and sanitation behavior.
Some of them still have temporary toilets. About 9 households have permanent toilets, and are we all happy about it?
Yes, we are.
Sunakesari Thapa from Karkidada Bhumesthan 8 Dhading is truly an example of this. When the CLTS program was facilitated 6 years ago in the community, Sunakesari was the first person to construct a toilet. However, she had to work very hard to build it. There was no man in the house. She and her daughter-in-law together crushed stones and dug the pit. For 9 consecutive days, Sunakesari went to the Mela, village fair, and sold 2 chickens to make enough money to pay a skilled sanitation mason. Finally, she was able to build a toilet.
We went there to the stream with a hammer, crushed the stones on our own, carried it up and built a toilet. Constructed it hoping that life would be easy, comfortable, and it would save us from the shame. Earlier we faced a lot of problems. It would be dirty and smelly everywhere.
After building a toilet near the house, Sunakesari feels relieved. Now, in her old age, she is free from the trouble and risk faced while going far out in the open to defecate. The different tools and methods adopted under the CLTS program have opened the eyes of many like Sunakesari. People are now more aware about their hygiene and sanitation. There have been improvements in their health. Prevalence of diseases has reduced drastically in the community.
When we didn't have toilets, vomiting, diarrhea and waterborne diseases was commonly found. According to the HealthPost report, only 30% of people had toilet facility then. The remaining 70% households didn't have toilet. They defecated in the open areas. Earlier, many patients who suffered from diseases caused by contaminated water and common illness resulting from lack of knowledge on health and hygiene visited the clinic. Now, the record is very low.
These women of Dharmapur Chitwan are so happy at this old age to be able to use toilets next to their doorsteps. Why wouldn't they be, after all? Holding themselves throughout the night due to the fear of being attacked by wild elephants and rhinos in the open still freshly run through their minds.
When there were no toilets, it was very difficult for women. Had to go out in the open to defecate, and sometimes due to the shame of being spotted, had to return even without defecating. What to do? We did not know then that we had to build toilets. We did not have the common sense to use a toilet for defecation. Now we are at ease as we have a toilet in the house. We don't have to go outside. Besides, there is no fear from wild animals.
Triggering tools or the tools to ignite sparks of awareness in people has played a significant role for sustainable management of sanitation in the community. It has supported to bring sustainable hygiene and sanitation behavior changes in the community. Even these small children are now aware about their sanitation. A new sanitation culture has also evolved among the aged. This house under construction in Karkidana Bhumesthan 8 Dhadin will still take some time to complete, but a toilet has already been constructed here. This proves how conscious the villagers are about their sanitation. Besides, whenever a toilet breaks down, quick repair and immediate use has taken place.
Before, none of the houses on the roadside had a toilet. Our relatives there, they too didn't have one. But once the toilet construction campaign began in our community, not only those households falling within the project area, but those houses alongside the road also immediately built one. Even those unable to build a toilet due to poor economic condition are ready to build toilets on their own. This program has had an impact not only in the community but also in various other communities and project areas. Toilets are under construction.
The CLTS approach gives emphasis on community, taking lead of this process to achieve total and sustainable sanitation. Triggering tools are used to inspire community members about their sanitation. To keep the momentum of this going, a particular aspect of the community is taken forward in an organized manner. These organizations, which rather give emphasis to community situations than to state policies, mainly work on the basis of existing values and social norms. Presently, child clubs, women's organizations, and networks, as well as various organizations, are working in the communities to make their community open defecation free. These organizations have been taking actions against the open defecators by trying to bring them within the limits of these social norms.
If we find anyone defecating in open places, we ask, why have you defecated openly? We tell them, you have to defecate only in a toilet, you must not defecate in the pathways. If you defecate in the open, then the pathways become dirty, it smells bad, and will even be difficult for us to walk on the road, and try to make them understand. If they refuse even after such persuasion, then we fine them.
Only if people can make sanitation a part of their living, then only a sustainable change in this area can be achieved. Hence, keeping this fact in mind, organizations involved in sanitation promotion are facilitating the CLTS approach in communities. Lack of good hygiene and sanitation practice has made people's life very difficult. There is untimely death of millions of people due to inappropriate use of toilets and failure to practice the basics of hygiene and sanitation. According to UNICEF data, 1 gram of feces can contain 10 million viruses, 1 million bacteria, 12,000 parasites, and 100 parasite eggs bearing various diseases. Likewise, a WHO study reveals that the simple act of washing hands with soap or ash and water after defecation can reduce the diarrheal incidence by 45%. Even the nation is yearly bearing a great loss due to disease caused by lack of improved sanitation. Yet sanitation has failed to make it to the priority list of the state and the civil society. While the need to establish water and sanitation as a basic right is being raised globally, the state needs to be additionally responsible to assure these rights to its people. But rights without responsibilities are incomplete. Hence, the people should themselves be aware and active about their sanitation. Only then, the national goal of attaining universal coverage in water and sanitation by 2017 can be achieved in Nepal. This is also the essence of the community-led total sanitation CLTS approach.
यही गतिमा हामी अगाडि बढ्यौं भने हामीले विक्रम सम्वत 2003
If we move at this pace, we will not be able to achieve the national goal of providing drinking water and sanitation to all the people by 2017. For this, we need to make those extra efforts. There are no national programs planned as yet to guide what and how such efforts must take place. Hence, if we can take forward this total sanitation program on a massive scale, this will contribute to bring down the yearly death of 10,500 children under 5 caused by lack of sanitation.
फोहोर हातले बासी खाना खायो सानो नानीले आउ हैजा झाडा लाग्यो यस्तो बानीले हे लो है साथी हात धुनलाई कहिले पनि नबिर्सनु साबुन पानीलाई